Hi everyone, I am Dr. Naveen Salins, and I'm going to speak today about emotions and pain. We always have an understanding about pain as a physical sensation, something that what we feel, and we experience pain because of many reasons. It could be a trauma, it could be a pinprick, or it could be a burn when you're cooking. But I'm going to talk today pain in a different context where I'm not just talking pain in terms of a physical sensation, but I'm going to talk pain in terms of emotions and how emotions influence pain and pain influence emotions. If we look at the literature that is there available for us, the first question that I asked myself is what is recent about emotions and pain? There is an organization called IASP. So IASP stands for International Association for the Study of Pain. So the job IASP does is they spend a lot of time in studying various aspects that influence pain, and also they also study about how to make treatment of pain better, understand various types of pain. So why I am bringing IASP is that in 1979, the IASP came out with a definition of pain. Around 41 years later, they found a need to redefine pain. So why they found a need to redefine pain? Because previously, the understanding of pain was always as a physical sensation. But now we know more about pain, and it's not just the biological aspect, it is the psychological, the emotional, the social, the spiritual. So there are many aspects to pain. So that's the reason why they thought that they should define pain. And this is the word cloud of the definition of 1979 and in 2020. So if you look at 1979, it all talked in terms of physical. It looked at damage to a tissue, which looked at a sensation. But if you look at the 2020 definition, if you see the word cloud, it talks more about experience. It talks more about psychological. It talks more about social. It talks about person. So it has so much aspects that has been added to our understanding of pain. So let's look at this new definition of pain and how pain and emotions are connected. So if you look at this slide, it is a very busy slide, but I'm going to go to each part of this slide slowly, and we will try to understand the pain in terms of emotions. So the new definition of pain by the uh, International Association for Study of Pain had six parts, and they called it as keynotes, six keynotes. And each keynote spoke about one aspect of how emotion is connected to pain. So I'll be slowly discussing each of these keynotes with some examples and from my experiences. And let's understand how pain and emotions are connected. Now, let's go to the first keynote, that is keynote one, which says that pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. So, pain is not just a clinical diagnosis where a doctor makes a diagnosis and prescribes you some treatment. It is not that just a clinical phenomenon. It is a personal experience, and it has got multiple things that influence that personal experience, which includes biological. So when we talk about biological, it is our body. It could be the bone, the muscle, the tissues, the nerves, which is getting damaged, and because of various causes, the biological cause. The psychological, our mind, how our mind is perceiving that pain, how our mind is interpreting that pain, how our mind is ascribing meaning to that pain, and the social factor, the surroundings. So it's the mind, body, and the surroundings. Everything influence that pain. So the keynote one states that the pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. Let us understand that a bit more. So I'm giving an example of Mr. R, who is a 34-year-old man, father of two young daughters. He is diagnosed to have an head and neck cancer, a cancer that is originating from the right buccal mucosa. He has quite a significant pain over the right side of the face. He is very irritable, he is sad, he is anxious, he is unable to sleep. He is worried about what's going to happen to his family, what's going to happen to his daughters, who is going to look after them. And in the back of the mind, he thinks that the God is punishing him. Now, this is not just a physical pain that is coming from the cancer that is situated in his jaw. The pain is much deeper and has got multiple layers into this. Now, if you look at the cancer itself and the pain originating from the right side of the face, those are the biological factors. So the cancer causing infiltration into the bone, infiltration into the tissues, nerves, are all biological factors. But the face it with the diagnosis of cancer, the diagnosis of cancer itself is traumatic for him. It has caused a lot of emotional distress. He is a father to two young daughters. He is a breadwinner of the family, and he has to think what happens after he is no more there, or after he is no more able to provide. Who is going to provide to them? And also, this diagnosis has caused him significant amount of emotional distress. He's upset, he's angry, he's anxious, he's worried. And also, there is a lot of spiritual distress that God is punishing him. So, how can you define this pain only in terms of a physical sensation when there are so many layers into it that is defining his pain? So, that's very important to understand what we call is as the biopsychosocial model. The doctors are very good in knowing the biological model, and the psychological, social, and the spiritual or cultural aspects is largely ignored. So we need to identify this biopsychosocial factors. So there are so many things, that aspects that lower pain tolerance and aspects that raise the pain tolerance. Now suppose you are happy in you're able to sleep well, you are well rested, and you have been well communicated about your illness. You have a good family support. There are people who are able to understand what's going on in you. You have a strong companionship. You are part of a social groups, and you are in an environment where you can express your emotions. You will be able to tolerate pain much better compared to another individual who is in a lot of discomfort, who is not able to sleep, who is tired all the time, who is alone, probably bored, nobody to talk to, no companionship, not part of a social group, feeling abandoned, not communicated well about the illness. So, how do you cope with pain? So, your environment, that what you live or what surrounds you, helps you to cope with pain. That means your final perception of pain is better when you have a good environment, a good environment that facilitates good communication, good companionship, part of a social group, and it's where it's open for you to express emotion. So that's why it is not just a physical sensation, but a larger concept that we need to understand. So this was about the keynote one, where we talked pain as a personal experience. The keynote two tells that pain and nociception are different phenomena, and pain cannot be inferred solely from the activity in sensory neurons. So, this term nociception is a technical term. So, nociception means that it is the biological mechanism causing the pain, which includes neurotransmitters, nerves, receptors, etc. So, we cannot reduce the pain to a biological mechanism. So, the keynote 2 says that just reducing the pain to a biological mechanism is probably a wrong approach, which healthcare system often does. It reduces everything into a biological mechanism. So that's why pain is a much larger, much broader construct than a biological mechanism. So that's why you cannot just equate pain and nociception. So, what does it mean? The keynote 2 means. Now, don't worry about this pathway. So, there is a big pathway where starting from the point you get injured to reaching the brain, it goes through a pathway called as the pain pathway. So, lot of these medications, what doctors prescribe, or the procedures they do to relieve pain, actually can work only in the first two steps of the pathway, which we call transduction and transmission. So, the most of the thing that happens is what we call modulation. So, modulation is the emotions that modulate the pain. So when the pain signals are going through the pain pathway, finally the pain is felt in the brain, and these signals go through the pain pathway and finally reaches the brain. Before it reaches the brain, there is a phenomenon called as modulation of pain. So modulation means the pain becomes more or pain is felt less. And the modulation is clearly dependent on emotions. As I said that, suppose you imagine that you are in your happy place, you're you are with in a good company, you're gone on a vacation, you're surrounded by friends, and you're very happy, joyous, you're laughing, and suddenly you hit your head on the pole or on a window pane, and there is a cut. You experience pain. I'm not telling that you don't experience pain, but very soon you forget about the pain because your mind is so occupied in the things surrounding. Or the modulation mechanism of pain suppresses that pain sensation. So you may feel a little pain, and after that you come back to normal, and you forget about pain. But you imagine that you are in a situation, you're having a bad day, you had a fight with your spouse or your family member, things are not going well, you're very frustrated, you're very angry, and you hit the same window pane with the same intensity. But the pain that you will experience is much, much more than the situation that I mentioned earlier. Why? Because this modulation mechanism is upregulating your pain. That means you're feeling more pain than what you should. So, this mechanism of pain is the one that connects emotions and pain, what we call it as pain modulation. So, lot of work that has to be done in pain management is on pain modulation. But unfortunately, what happens? Lot of work is done on nociception, where your doctors are happy to give you pills or do some procedures, but that helps only the nociception part of the pain. But other things that what you do, maybe having a good counseling, having somebody to speak to, having good emotional support, being supported, being communicated, that is what helps the modulation of pain. And that's where the emotions connect to the pain. So this is just another diagrammatic representation of the pain. So the pain has multiple dimensions, and we most of the time our dimensions are only focused on nociception or the biological aspect of pain, but the emotional aspect of pain is the one that what we need to focus into. So, the first and second keynote, we talked about pain as a personal experience, and pain is not just a biological phenomenon but a larger construct. The keynote 3 says that through their life experiences, individuals learn the concept of pain. So, what do you mean by through their life experiences, individuals learn the concept of pain? So, we all of us have experienced pain before. So, our past memories influence the present experience. Suppose we had a pain in a very bad setting. This is what we commonly see in patients with cancer. So they were receiving chemotherapy, and during chemotherapy, the chemotherapy is administered into the vein. And those who are receiving chemotherapy, most of them have very bad veins because chemotherapeutic drug would have damaged a lot of veins. And during the procedure of giving chemotherapy, they may be doing multiple pricks, or some chemotherapy drug would have caused some leakage and caused a lot of pain. And when they come to another setting, and for a completely different reason to the hospital, and whenever they are asked for an IV line, they're very hesitant. They become very anxious. They're very upset. Why? The past experience of having this dreadful pain, very unpleasant experience, actually influence the present experiences. So it's very important to explore what are those past memories and how those past memories are influencing. So our brain is what we call as the neuromatrix. So it has a cognitive, sensory, and affective, CSA. Cognitive means our ability to understand, comprehend. Sensory is the physical sensation. Affective means the emotions associated with it. This is it's always in a continuous state of flux, isn't it? So it's very important to understand how the past memories are influencing the present experiences. So that's the keynote three. That is the through life experiences, individual learn the concept of pain. The keynote 4 talks about a person's report of an experience as pain should be respected. This was a lady who came to my outpatient, and she just curled herself, and in a flexed posture and she didn't have to tell anything, that I could make out that she was in so much of pain. Lot of time we try to objectify pain and say that no, I don't think this person is having pain. Pain is a personal experience. We talked about it. So when the patient reports pain, it is there. So believe. So whenever someone says that they have pain, it is there. We just believe, because we need to respect the individual expression of pain. We should never try objectifying pain. And rather than trying to be judgmental or objectifying pain, focus on the rich descriptive story they give. They say they can describe their pain, explain their suffering, and actually that's very important. So one of the shortcomings of a healthcare setting is people try to be very judgmental and try to very objectify and start telling that no, I don't think this person is having pain. You would not know whether this person has pain or does not have pain. So when the patient reports pain, the pain is present. So that's very important thing to know. The fifth keynote is that pain usually serves as an adaptive role and has adverse effect on function, social, and psychological well-being. So it's very important. So pain is protective for a certain extent. We call that as adaptive pain. But sometimes, or more often, it loses that adaptive role and becomes less adaptive or maladaptive. And when it becomes maladaptive pain, it directly affects the physical functioning and the psychological well-being of an individual. So, what do you mean by adaptive and maladaptive pain? You are cooking in a kitchen and suddenly you touch a hot vessel you suddenly withdraw your hand. Why? Because you have felt the pain, and that pain is protective because it has protected your hands from getting burned. Same way, you are having an severe pain in the abdomen, and the doctors, you go to a doctor and doctor says that you have an ureteric stone or an appendicitis, and they'll be able to fix the problem. These pains are important, they are needed because they are protective. But there are pains that what we have has got no role, because it is not going to tell you that you are having something bad, because you already know that there is something bad. Like a grandmother having an osteoarthritis of the knee, she knows that she has osteoarthritis and the pain is present, and that's a maladaptive pain or pain associated with cancer. This needs to be addressed. So, why we should manage pain? If we do not manage pain, the pain starts managing the person. What do you mean by pain managing the person? So, if the person is in intractable pain or not getting relief pain, they start getting deconditioned. So, decondition means that their bodily function starts coming down. They start sit. They start to be curled up somewhere, sleeping in the bed all the time, and their mobility comes down, and they start losing their muscle mass. So this whole deconditioning sets in if the pain is not recognized. Two, it has a huge impact on the mind. So people can become irritable, angry, upset, depressed. People end lives because of the pain. It has a huge impact on the immunological system of the body. That means that in people where the pain is not well controlled, they have a reduced immune function, they have a reduced ability to fight cancer, and also it affects on our endocrine system and the hormones that are produced in the body, and negatively influences the quality of life. So that's why it's very important to understand this biopsychosocial, where how emotions are impacting pain. So it has an impact on the autonomic system. Our blood pressure goes up and down. Our immune system that protects us from infection, protects us from our cancer growing. Our endocrine system, our hormones. It affects our mind, that is our cognition, and it also huge effect on the person. The interpersonal relationship becomes poor, you will not be able to work, then the finances as becomes very challenging. You start becoming isolated because you're deconditioned, you can't go anywhere, and the will to live also comes down, and that's when a lot of people end their lives because of a poorly controlled pain. So pain itself can cause a lot of disability in terms of their home responsibility, their occupation, sexual behavior, self-care, social activity. So there are a lot of disability could be there. And the last part of this presentation is that not everyone can open their mouth and tell or describe their pain. That is verbal description of the pain. Verbal description is only one way of describing pain. Inability to communicate pain does not mean that they are not having pain. Like people who are not fully conscious, they also experience pain. Children experience pain, neonates, newborns experience pain. People with dementia who cannot talk experience pain, but they may have different ways of experiencing pain. So, verbal description is only one of the ways to express pain when there are so many other ways to express pain. Like, for example, people who are unconscious or demented, they may have a noisy breathing, harsh breathing, or they may look very sad, very worried, tears rolling down the eyes. The whole body becomes stiff. They become very agitated, tense. All these things could be non-verbal descriptor, non for the pain. Children have a different way of expressing pain, and the pain describing ranges from age to age, whereas a child with 0 to 2 years may just have some pain behaviors like inconsolable cry or body posturing, and they start verbalizing pain only from 2 to 4 years. And only when 5 years they'll be able to tell how severe the pain is, or in 6 years they may be able to tell different kinds of intensity. But only when they're 7 to 8 years or up to 10 years, then the pain history becomes very, they may be very vocal in describing. And again, these are the various scales that what we use in children. So basically, we talked about the theme for today's talk was emotions and pain. And I have connected the emotions and pain based upon the six keynotes that was presented by the International Association for Study of Pain on describing emotions and pain. And I thank the eCancer for providing me with this opportunity to make this presentation. And if you have any doubts or queries, you can email me on naveensalins@gmail.com. Thank you very much.